Staying close to people, helping them when they need it most, and advocating to improve their quality of life are activities that have characterized Fundación MAPFRE for 45 years. Because of this, Fundación MAPFRE leaped to action when COVID-19 stopped being a threat and led to a full-fledged public health, social, and economic crisis. We decided to reorganize our activities and channel our resources to confront the pandemic head-on, relying on our extensive experience serving the communities of 27 countries worldwide. In order to combat COVID-19, we have created an ambitious course of action based on 3 areas of focus: scientific research, health infrastructure support, and social assistance. Altogether, during 2020, we will invest 35 million euros. Learning about the disease in all of its complexity through a global approach is the most efficient way to successfully fight it. SARS-CoV-2 is a novel coronavirus about which more is unknown than known. It is essential that we understand how it is transmitted, identify the most vulnerable to infection, and learn how to help them. Scientific research can help us find an effective treatment and a vaccine to neutralize the virus, as well as instruct us as how our health systems should respond during an epidemic. As the pandemic started to take its toll, we activated our emergency aid networks, working closely with the authorities of each country, and thanks to the effort of our volunteers, so that help could arrive as quickly as possible. We acquired medical personal protective equipment, PPEs and ventilators, and set up emergency medical units, field hospitals, and completed diagnostic tests. At Fundación MAPFRE, we have always felt a special compassion for those suffering from physical, social, intellectual, or emotional disadvantages. The worst of this crisis will pass, but its consequences will continue to affect the most vulnerable, particularly those without resources, the elderly, the families of victims, the self-employed, and small businesses. We have assistance and advice programs in place for all of these groups so that they can start to rebuild. If we can make it so that one unemployed person finds a job, one small business stays open, so that one elderly person feels less alone, or that the relative of a victim receives consolation, we will feel pleased because we know that more like them will follow. This is how solidarity works. Once sown, it multiplies like a benevolent virus that we want to propagate. And this we will achieve. In fact, we are doing so right now because there is no treatment nor vaccine for the virus of solidarity. It defeats all.